We can start? Okay.
Hello, I'm Rhoda Weiss, co-chair of this Becker's Conference and a national healthcare consultant. Thanks for joining this keynote today of an incredible executive, one of the nation's most prominent and transformative healthcare leaders. 4 years ago, Johnese Spisso came to UCLA Health, a world-class system with a world-class name in a complex city with an extraordinarily competitive and diverse market. Johnese is president of UCLA Health, CEO of UCLA Hospital System, and Associate Vice Chancellor of UCLA Health Services. UCLA has 4 hospitals: the Academic Medical Center on the campus, a community hospital, a children's hospital, and a psychiatric hospital. 200 clinics, 3,000 physicians, 31,000 employees, 600,000 unique patient visits, and nearly 3 million outpatient visits. UCLA ranks in the top 4 of the best hospitals in America by U.S. News and World Report, and 10 of its 13 specialties rank in the top 10, most in the top 5. Prior to coming to UCLA, Johnese spent 20 years at UW-Medicine, most recently as Chief Health System Officer and Medical Affairs Vice President. Prior to that, at UC Davis Medical Center, she held management positions and began her career as an ICU nurse. Johnese serves on several national boards and is frequently honored, most recently named among modern healthcare's most influential women and top clinical leaders in the U.S. Her ability to transform healthcare in LA is no small feat. With consumers and employers expecting value-driven care, networks narrowing, unexpected affiliations, and health coverage not always available, she's expanded UCLA's role as a healthcare leader. UCLA's mission is to heal mankind, one person at a time, by improving health, alleviating suffering, and delivering acts of kindness. In Johnese, our great City of Angels has an amazing healthcare champion who embodies this mission. Johnese, your deep background in clinical care and business gives you a perspective from both sides of a CEO's desk to form an especially focused vision. You started as an ICU nurse, you rose through the ranks at UC Davis, you've led critical care and trauma and ER and life flight. You spent time at UW-Medicine in Seattle, moving from CNO to COO to Chief Health System Officer and Medical Affairs VP. You've led community hospital integration and developed the state's trauma system. Now all of us in LA are benefiting from your efforts here at UCLA. So how have all of these experiences informed your leadership, your vision, and where you are today?
Rhoda, thank you for having me, and let me just start by saying what a privilege it is for me to work at UCLA Health and to work in this amazing city of Los Angeles, and we're so grateful for the support that we get from this community in order to deliver world-class health care. For me, starting my career as a nurse and starting at the bedside really gave me great visibility on what patients and families need, what different members of the team need, how everyone comes together at that point of care to do our best to make sure patients and their families have the best outcome and can get all their needs addressed. That fundamental understanding, I think more than anything, helped guide my journey through healthcare.
You're entering your 5th year as UCLA, as a CEO and a president. You've made significant accomplishments, which all of us in Los Angeles appreciate, and more in the future. And then there's COVID. So what have you learned? What have been the challenges? What have been the surprises? And how's your pre-COVID plan evolving with today's uncertainties regionally, nationally, and globally?
Well, that's an amazing question, and we have learned so much in this unprecedented time. I'll start by saying I think all the great work that we've done as healthcare systems in our community to prepare for disasters has really served us well. And every year we have drills that look at emerging infectious disease, earthquakes, crashes, anything that we can do to test our system and our resilience. That served us well as we faced the pandemic, because very early on we were able to operationally implement our disaster control centers, get everything together to make sure that we had the resources and the resiliency to guide through the pandemic. I think what we've learned is that first and foremost, our staff are amazing, And I think if anything inspired me each and every day, it was the courage of our healthcare professionals. Before we really even knew how this disease was transmitted, they were there with us on the front line, learning with us, working with the CDC, working with World Health, working with LA County Health Department to say, what do we need to do to protect our patients and our staff? And their commitment and dedication to patients is really what allowed us to sail through this.
You know, one of the greatest challenges for all of us during COVID has been the fear and uncertainty among our staff, among patients, among families, and our communities. We learned that every 1.9 seconds in this country, somebody tests positive for COVID.
Yes.
And every 190 seconds, we face a death. So how are you able during this time to keep care centered? It's unprecedented time, and successfully implement, which I find so interesting, your 4 S's: safety, staffing, supplies, and surge.
Yes, yes. And I'll say that through this pandemic, we've learned some interesting things. We've all worked through emerging infectious diseases before. We've had the SARS, we've had MERS. What was the most challenging, I think, about COVID is that unlike SARS and MERS, patients looked very sick. So you could really see people who needed to be isolated. With COVID, we had the silent asymptomatic transmission. And as that was unfolding, that was very scary to the public. It was very scary to our staff. So we really, I would say, what helped us get through this was communication. We had a command center that was operational 24/7. We had meetings every 4 hours. We had our team in communications and marketing working with us round the clock to write 300 new patient care protocols in a short period of time, get that out to staff, and make sure staff were trained. We were simultaneously working on securing additional PPE to really make sure that we could protect everyone. So it was a lot of efforts, but I think coming back to those fundamental principles of disaster management and of emerging infectious disease really helped guide us.
Pre-COVID, there was a lot of discussion out there about the future of academic medical centers and their ability to compete in the marketplace because of higher costs associated with research and education. Now most pundits realize that clinical care, education, and research are what will likely get us through this pandemic and set the stage for better health and better lives overall. Tell us how UCLA in particular and academic medical centers generally are transforming health and healthcare in relationship to COVID and other initiatives.
And I think that's one of the silver linings of this pandemic. Very quickly, the public saw the need to invest not only in public health, but in research and education. Knowing that we were research institutions and we had with us around the clock scientists and really innovators who were looking to say, how can we get through this? What kind of testing do we need? How do we really begin to look at a vaccine? That whole research engine at UCLA Health and our David Geffen School of Medicine and at other academic medical centers around the country began partnering. We were having national calls, pulling all the experts together. Within the UC system in California, we pulled together our 5 health centers and our schools of medicine to say, where do we have the scientists and the researchers that are working on this? How can we get funding into their hands to really accelerate their work? And as a result, you know, we were one of the first in California in March to be able to do our own COVID-19 testing. We didn't have to rely on waiting 4 and 5 days for results to come back from national labs. We could turn those tests around in a few hours. Most recently at UCLA Health and at our David Geffen School of Medicine, we've developed a rapid action saliva test so that we can do mass testing and hopefully get everyone back to work.
I was going to ask you about that, actually. I was going to ask you about the scientists at UCLA are really pioneering treatments and testing for COVID, including the swab-seq, to enhance testing. Can you tell us a little more about that and some other innovations that UCLA Health is doing in terms of COVID?
Yes, I think, you know, particularly around the lab innovations, what people wanted is something that was fast, inexpensive, and could be used for thousands of people together, right? When we think about returning people to school, returning people to college campuses, you have to have the ability to test many people every day and get that result back quickly. So our team really worked on developing something that was fast, cost-effective, and most importantly, reliable, because we saw a lot of the concerns with some of the early testing on is it reliable or not. The other area that we worked on was around innovation, and we had our team in innovation working with students, really coming up using 3D printing to make us face shields, other types of stations so we could do drive-through testing behind a safe barrier so people didn't even have to get out of their cars. So it was just amazing to see that all come together. And being at a research institution, for me personally, it made me see the value of those investments really front and center.
You know, speaking of UCLA and innovation, UCLA is a health innovator's dream. Medical Plaza, everything is there, the main hospital on the campus, the schools of medicine and nursing and dentistry and engineering and business and public health. They are nonstop opportunities for partnerships with researchers and clinicians. UCLA has this incredible history of health innovation, Nobel Prize, National Medal of Science, legendary in genetics, going back to sequencing in 1865 with the discovery of the law of genetics, research leading to CT and PET scans, brain mapping, neuroimaging, tissue matching tests making organ transplants possible, targeted treatment for brain aneurysms, melanoma, breast cancer, Herceptin, which all of us know someone whose life has been enhanced because Herceptin was the first drug to attack cancer at the genetic level, and more. Like those just mentioned, UCLA has incredible initiatives. I want to just name some things, and if you can react. First, the Institute for Precision Health.
Yes. And that is an amazing institute that is really coming together to really say, how do we deliver the best medicine and the best treatment to patients specific to their disease. It allows us to eliminate wasteful treatments that don't make a difference and really focus on those targeted treatments. The group of scientists that work in there and their work on day-to-day interactions with our clinicians really allows us to bring these institutes forward for the public.
UCLA Biodesign.
Yes, the biodesign, we were thrilled to have this opportunity. We're only one of two in the country who has put this together and really looks at how, just as you mentioned, being on a campus where you have all of these amazing schools, in addition to medicine, nursing, you have engineering, you have all the health sciences, you have public health. How do we bring all those experts together to really innovate and make solutions? And that has gone very well. We fund fellows every year that bring the latest and greatest. We have an innovation contest. And I'll say the hardest thing is, over the 400 and some entries we get each year, which ones do we select for funding? But seeing that, I think, really inspires everyone, even in our community. We've had an amazing response from the philanthropic community in Los Angeles in helping fuel some of these discoveries that are really changing medicine and changing the world.
Another one that's changing medicine and changing the world is the California Center for Rare Diseases.
Yes, this center is so important. People come to us from all over the world really looking for solutions for rare diseases. A lot of these diseases really being abandoned on the research side because it isn't large numbers of patients. It's not something that people do if they're looking to grow profitable business lines, but it's so important in the lives and the health outcomes of people who are facing those diseases. And our teams who work in those areas follow these patients throughout their lifetime and really are inspiring.
You know, one I'd like to sign up for is the Atlas Community Health Initiative. Can you talk about that?
Yes, that is an important initiative. We've been really looking at how we continue to launch that, really collecting samples from patients to learn more about illnesses. You know, there's so much being done now on the genetic contribution to illnesses and identifying patient populations. I must say, front and center, we like to thank people like you and our patients who are willing to contribute to these studies that help us really improve care for all.
Pivoting to healthcare costs. Even before COVID, healthcare costs were skyrocketing with reimbursement rarely matching the rise. Over half the hospitals were in the red. Then COVID struck, and electives were delayed for weeks, even months. A recent study saw operating margins down 90% for the first 8 months of this year. Not counting the relief funds, health systems are holding off or rethinking capital projects, reassessing portfolios, and sunsetting services. How is UCLA doing, and what do you see as the impact for providers regionally and nationally?
In the first few months of the pandemic, because we did have to reduce capacity, reduce occupancy, defer a lot of cases that were non-urgent or emergent, and still keep all of our staff there, right, preparing for a surge, we saw drops in operating revenue that were to the level that none of us have really ever seen before. I will say that, once we got through those first few months, we began to learn how to run a health system with COVID, right? We kept saying we can't just sit here and be COVID health systems when the public need us for so many more things. So through that work and through educating the public on how to return for their care, how we were doing to really deliver that care safely and effectively, helped us get our patients back. So now we're fortunate to be back at 100% occupancy. We'll never make up all that lost revenue. Providing care now in a COVID environment is more costly and more resource intensive, but we've learned how to do it, and the resiliency of our staff in getting there has really helped with that. Going forward, we, like many other health systems, will continue to propel our performance improvement plan to really deliver that value-based care, continuing to look at anything that really introduces inefficiencies and waste, how we can cut those out and continue to deliver our high-quality care. So it's a new book of challenges for us, but I will say through the things that we've learned through telemedicine and other things, we've learned how to deliver care more efficiently, and I'm hopeful that those initiatives will lead us to better savings in the future.
I spoke to my UCLA physician via telemedicine, and it was great. So do you see more of that in the future?
I do, and I think, prior to the pandemic, we were averaging about 150 telemedicine visits a week. We quickly shot up to 10,000 per week. So it forced our providers and forced our patients to really use that tool. And what we've learned is there are certain types of care that we can deliver very effectively there. Shifting those visits to telemedicine opens up tremendous capacity in our clinics for the people who actually have to see us in person. So I do think there's a value analysis there that will help us going forward.
Early in March, we learned many people weren't seeking medical care when they needed it, and when it was critical to do so. We were getting reports from ER physicians and others that people were not coming in for heart attacks. Paramedics were telling us the numbers were going up exponentially of people dying at home of heart attacks. People were not coming in for strokes during that golden hour. Late-stage cancers. Kids were not even getting immunized, and we were worried about a pandemic with measles and whooping cough. And one of the things we're finding now is because schools aren't in person, that they're not even getting their chicken pox. One of the things that we did in LA, which was unprecedented, is we brought together the 6 largest, most comprehensive health systems that have been very fierce competitors. So you're talking about UCLA and Cedars-Sinai and Keck Medicine of USC and Dignity and Providence and Kaiser, turning over their media assets in a comprehensive campaign to encourage access and care. The group still meets. We met last night, and we have new initiatives, and we're going to stay together. What's your thought about competitors collaborating more in the future?
Well, first I want to thank you for your innovative idea in getting us all together and bringing that forward. That was an amazing activity, and we all benefited tremendously from being a unified voice to our public that was very frightened, right? Hearing a lot of mixed messages. Our ability to talk together, excuse me, and get that message out clearly from organizations that they trusted was paramount to getting our patients back in.
UCLA is one of the nation's most ethnically and culturally diverse campuses located in a culturally and socioeconomically diverse LA County. For UCLA Health, diversity is an asset. Treating a wide variety of patient populations means a broader range of disorders and health challenges, sparking new ideas for finding cures and solutions that work for everyone. So let's talk about equity, diversity, and inclusion, since UCLA is doing some amazing initiatives, and let's start with your own team. While executives at every business sector work to diversify their executive ranks, it would be hard, and I mean difficult, because I look nationally, and I don't know anyone else that has a leadership team that's more representative of diverse populations than what you have assembled at UCLA. How have you done that, and what are your next steps to ensure diversity reaches all levels of the enterprise?
Well, thank you. And now more than ever, health equity, diversity, and inclusion are such an important part of everything we do. One of the things we noticed early on in the pandemic is we were seeing differences in outcomes, particularly for the Black and Latinx population. And understanding that really highlighted the work that we need to do on health equity, particularly in a city as diverse as LA. We see tremendous outcome differences. And at UCLA, we feel we need to be a part of solving that, giving the resources that we have and the ability to really study and learn more. Additionally, we've continued to work over the past several years on diversifying the team. When I came in, one of my goals was to really have a team that was more reflective of the population of Los Angeles. And we work very hard to really make sure we're doing inclusive search committees where we're looking for the best and brightest and casting a wide enough net so that we can bring in the top talent and really reflect our commitment to diversity as well. And we've been very successful in really recruiting amazing individuals that have helped us really learn.
UCLA Health is creating this system-wide data infrastructure and interactive dashboards to monitor and advance equity in clinical care and outcomes throughout all the patient population. Can you tell us more about that?
Yes, you know, it is one of the things. We have an amazing infrastructure and information system, but we haven't actually used that data all the time to really guide some of the decisions that we need to make, particularly around health equity. So this year we're making some additional investments in data and analytics so that we can really study our patient population, understand where we have barriers to care, how we work together to remove those obstacles. You know, I think we all felt that the first step was the passage of the Affordable Care Act, which really provided coverage to more people. But one of the things we know is that coverage doesn't equal access. There are still barriers to care, why certain populations, particularly our most vulnerable populations in Los Angeles, can't access the care that they need when they need it. So we're really looking at that. We're looking at our community benefits in a much more in-depth way to really understand those barriers and come up with action plans that I think will help reduce disparities.
UCLA Health is also doing something that I find so exciting. You're developing a UCLA Hospital System and a David Geffen School of Medicine racial justice scorecard to assess performance in diversity, equity, and inclusion compared to similar organizations. How will that work?
We are on that journey, and I will say what has really guided us is having the conversations with staff. Even in this virtual environment, the Vice Chancellor and the Dean of the School of Medicine and I have hosted conversations with leadership where we can have employees, faculty, staff at every level in the organization share with us their thoughts and their goals. We've done some surveys as well to really gain information, particularly from groups of staff that we haven't heard from as loud and clear as we need to. That's really helping to guide and shape our work plan, as well as forming some councils with key staff representatives to really monitor and really hold us accountable on the delivery.
UCLA has a lot of partnerships, and I have to mention partnerships also with the world champion LA Lakers and Los Angeles Dodgers. Those relationships have resulted and continue to result in many important health initiatives, like helping get the word out and staying healthy and safe during COVID, staying resilient and supporting many community outreach programs, like one of my favorites, the Sound Body, Sound Mind,
Yes.
which is providing phys ed programs to many schools in underserved areas. Can you talk about that?
Yes, and so first of all, what a great year it's been for Los Angeles. In August, when we found out at UCLA Health that we were the #1 healthcare system by U.S. News and World Report in Los Angeles and in California, we were thrilled. And then our two partner sports teams, the Dodgers and the Lakers, winning their championships was a great bonus. We were first thrilled when those teams chose UCLA Health for their care to be the team physicians. But the added benefit we had of those partnerships was it gave us the ability through our community benefits to work with their foundations to really do so much for the underserved. During the pandemic, our staff partnered with Lakers and Dodgers. We delivered backpacks to students at home. We had Sound Body, Sound Mind produce yoga and fitness kits to deliver to 14,000 of the most underserved students in LA. We did drive-through food deliveries at our warehouse, all sponsored by those sports teams and their foundations. In addition, they turned around and gave us tremendous amounts of support for our healthcare workers. We provided over 35,000 meals to healthcare workers. We provided Lakers merchandise, Dodger merchandise. In addition, the Lakers partnered with the grocer, and 800 of our lowest paid staff received 4 bags of groceries through grocery stores to really get them through the pandemic. So it really does show, I think, the value in Los Angeles of these organizations with a mission to support the community coming together.
You know, healthcare has changed so dramatically over the years. When I started, if you had cataract surgery, we put sandbags on the side of your head and you didn't move. And you were in the hospital for a long time. Until recently, hips and knee surgeries you were hospitalized for several days. Now the majority are taken out. We have cures for so many things. And yet with all of these changes, it's that fragile human thread of life that's still important. I know how important patient-centered care is to you and how much you've done at UCLA that many of us have benefited from. Can you talk a little bit more about that and how things have changed, but some things never do?
That's such an important point. And, regardless of the care setting and all of the improvements that we've made in healthcare, it really does come to that experience that the patient and family have with their team. They expect us to be knowledgeable. They expect us to be providing the best medicine, but it's really how we make them feel through that whole experience. Are we delivering that care with kindness and compassion? Are we culturally sensitive to their needs? Are we listening to them and including them in their care plan? And are we giving them hope, right? We see so many patients where they are facing, life-changing issues for them and for their family. And how do we, through this leading-edge care, through this sense of research and discovery, how do we inspire them on that journey through their health care? I think that is most important. And I will say, I think personally for our patients and their families and our staff, the hardest thing with the pandemic is that there were times early on when we had to severely restrict visitors. How scary for patients to be hospitalized and not have that loved one there. Our staff went the extra mile to do whatever they could, but nothing makes up for not having that loved one with you. Especially, in healthcare over the years, we really focused on the family setting visiting hours, letting people sleep in rooms with their loved one. And we had to come out with these really draconian measures during COVID. What we saw, though, is staff really working with families to say, how can we get you in, using iPads. One of the most novel things I thought was we have a very active pet therapy team. We have 98 pets that really volunteer and work in every hospital that we have to really help patients get through it. We couldn't have the pets in, so we did very large cardboard cutouts of the pets that we could put in the room, and then you could actually schedule a virtual pet visit. So our volunteers who couldn't come in stayed at home, worked from home, and scheduled their pet therapy visits. It was the little things like that that brought joy, particularly to our children in the Mattel Children's Hospital who are used to those pets being around all the time. So I really commend the staff for that, but I also feel that, you know, the families went through so much, and even though we tried, there was, you know, not always things we could do to ease their suffering, which was really hard on all of us. I will say that early on, as soon as we had enough PPE, as soon as we knew we could screen safely, we worked very hard to allow every patient to at least have one family member with them. And I think that did a lot. That helped patients want to come back for their care. Part of the deferring of care is people didn't want to face that alone.
Mm-hmm. UCLA Health is really unique in that you have an academic medical center and a community hospital and a children's hospital and a psych hospital. So you've got pieces that most health systems don't have. How do those pieces come together, especially looking at the future? In psych especially, because of all the mental health issues that have arisen because of COVID-19.
Yes, and having that full complement really allows us to do everything to serve the community, from, you know, primary care to the most complex tertiary care, to behavioral health, to children's health. And one of the things that we've definitely seen is the need to invest more in behavioral health. Okay. I don't think we've seen the full effects of what this pandemic has had, particularly on our youth. We're already seeing rising numbers in LA of people who need behavioral health services because of the escalating depression and anxiety that this new world has caused, and the critical lack of resources. You know, we operate one of the few inpatient psychiatric hospitals, and we are always bursting with patients, boarding patients every day in our emergency departments. So we are looking at saying, you know, how do we really, as part of that community benefit, how are we going to expand these services to meet the new needs that are expanding? And we can't do it alone. We look forward to partnering with other facilities in the community so that we can meet this growing need.
Speaking of partnerships, you've done a lot of interesting, amazing things. You are partnering with community hospitals by placing your hospitalists in those hospitals. Tell us about that.
Yes, as part of our outreach plan and our growth strategies, we operate over 200 clinics throughout Los Angeles and Southern California. Any of you who have driven in Los Angeles know the issues that we face with traffic, and also the capacity issues that we have at our hospitals. So we've partnered so that patients who need more of that routine hospital admission can be cared for in the community hospitals. We admit them to facilities that are close to where our clinics are, and provide a UCLA hospitalist to really guide their care. If they need the more advanced tertiary and quaternary care, they're automatically transferred to one of our sites. But it's allowed us to really leverage our resources and assets to really best serve the community in places closer to home for patients and their families.
What's the best leadership advice you've ever been given?
Wow, and I've had a lot of advice through my career from some amazing mentors. I will say, you know, I think the best leadership advice came from my parents, who always really taught me to be my authentic self, to be true to myself, to really stand up for what's right, even if that means you're standing alone. And I think that's really important in healthcare because of the things that we need to do, because of our need to really do what's right for patients, right, for our employees and our staff. It's not always an easy journey. It's sometimes not always a popular journey. But you have to have that commitment to your core values to really get you through it.
You know, if you can give some advice to those of us in healthcare, what would that be?
I think the advice would be staying true to our patients and families, looking at things through the lens of patients and families. Any of us who have had healthcare issues and have ever had to be a patient, you really see what matters most, right? And the understanding of that, that's what leads you to number one, right? that quality, that safety, that service, it's less about titles and things like that. It's really how the product, which is our patient, sees us. And I think that's the most important. I think if you get that right, the finances flow, right? Our highest risk is not serving our patients in the best way.
You know, it's interesting. Most of us came into healthcare because we wanted to serve the community. We wanted to serve the patients. And I know I've said this before, but you were like the best thing that's come to LA. You know, your experience that you brought to us, even with our earthquakes and fires and everything else, has been phenomenal, and it means so much to every one of us in LA. What is your vision for the future for UCLA and healthcare?
You know, I think for UCLA Health, we want to be part of the solution of making Los Angeles the best and healthiest city for everyone, for really serving patients from all walks of life, for really partnering with the community to keep this city vibrant, healthy, and going forward. And, you know, I think the assets that we have as a university academic health system to really not only lead discovery in medicine, but in so many other fields that are important for the environment, for sustainability, for everything that we do in public health. It's such a tremendous opportunity. And I know I speak for all of us at UCLA Health to say what a privilege it is for us to work at this institution.
And it's a privilege for all of us to have you here today. Thank you so much.
Thank you. Thank you so much for having me.